So today we have a further 37 new positive cases of COVID-19, bringing the total of confirmed cases here to 209. And very sadly, as Arlene has said, 2 people have lost their lives. And we want to offer our heartfelt sympathy to their families and their loved ones at this very sad time. Today we're also hearing reports of people having to continue in working conditions where social distancing is not being adhered to. And let me be very, very clear, that is unacceptable. If you cannot make provision for safe working practices, then you should not be operating. You're compromising not just your workers' health, but you're also compromising our response to this crisis. I saw again for myself, travelling here today, many men travelling to work together in a van. That is not acceptable. It's time to get real, because this virus is killing people. These types of actions are putting lives at risk. They're putting our health workers at risk, and they're adding to the colossal burden on our health service in the weeks and months ahead. So to business owners in the construction and the manufacturing sectors, you need to take responsibility now, and you need to act now. Ask yourself these questions. Is the service that you're providing an essential service? If so, can you provide a safe working environment for people, respecting the public health advice? And if the answer to those questions is no, then you should shut your doors. And let me be clear also that if you don't take action yourself, we will move in and we will close you down. This is about saving people's lives. All of this is about saving people's lives. I want to thank the vast majority of people right across our communities for their colossal effort in terms of fighting back against COVID-19, because this is a battle a day, folks. This is a battle a day for each and every one of us, and we have a choice. And I choose, and I know you all choose, to save lives. I also want to speak directly to our frontline workers in the health service. Many of you have been in touch directly. Nurses, doctors, domiciliary care workers, support staff, every one of you have told me that you're worried, and we understand that. You're worried about having the right protection to be able to do your job, to be able to care for people and to keep us all safe. You're worried about access to testing. So let me tell you that we hear you and that we are taking action, because we know that without you, we will not be able to get through this crisis. And we know that we need you to be supported to do your jobs. There will be a ramping up of testing, and we need to have testing for all of our healthcare workers who require it. There has been additional PPE secured. The Department of Finance, working with the Department of Health, is making sure that we have sufficient supplies. And we are working right across the executive to make sure that you have the support and the protection and the testing that you rightly deserve. Workers need to be protected. We need essential services to continue to operate, but workers need to be protected. So there needs to be the right work done in terms of making sure that that is the case. But we can't be we can't on one hand, ask people to stay at home, follow all the advice, but then ignore it for certain people who are out doing their day's work to try and make sure that we have food supply chain. So that can't be tolerated. I've spoken also today with the Health and Safety Executive, because their job is to make sure that they enforce legislation and make sure that they protect the workforce. So we need to make sure that is the case. I am really concerned about those people involved in non-essential work, out still doing the day's work. I used the example of men travelling in a work van to go to a job. That's not acceptable, that's not safe, so that needs to be stopped. The questions which I pose remain, and these are the questions which I note some industry representatives are also posing. Ask yourself, in your business, is this an essential service? And if it is not the case, then you shouldn't be operating at this moment in time. Sorry, so my view is very clear in terms of the legislation here. It has been out of date and it has failed women on many, many fronts. I'm glad to see progress on the guidelines and making sure that it's very clear and that we support women who find themselves in very vulnerable situations and whenever they need our health service to support them. But there's no doubt in my mind that a lot of people are really worried about shutting up their business and then what that'll mean for their own livelihoods, how they'll feed their own families. So we need support for the self-employed, and we need that to be confirmed. We needed it confirmed days ago, but we certainly will keep the pressure on. We as an executive collectively have said we need to see a support package for the self-employed, just as we did see for those people on PAYE last week. And I think that will help people to make the right decision in terms of what needs to be happening and allow people to stay at home, because that's what we need people to do. In terms of the Assembly, we have to lead by example. Whenever our frontline workers are being asked to go out, particularly those who work in the health service and take on the mammoth task which they have ahead of them, then they deserve, and our executive and our assembly should also be working every day to make sure we're taking the right decisions and showing political leadership. You don't ask others to do something you're not prepared to do yourself.